excited about the rollout of the covidtest.gov website. This is the plan the president announced before the holidays to distribute 500 million tests to every household in America that wants them. Boxes of 4 tests are going out. They have started to go out even now, and we'll be delivering them as the manufacturers send them in to the government. And it's a huge logistical operation to go out and get those tests from different parts of the world, but that's underway. Postal Service team has been amazing. So far so good. It seems like the user experience has been very favorable for people, and we're excited about that. And it's going to be, we're moving forward with it. It's sitting alongside the other testing programs that we have for people, the free pharmacy testing program, the program for community health centers, the new insurance program that came out last weekend to cover over-the-counter tests for people with private insurance. So we're just trying to make testing as available to people as we possibly can. So they're made in different parts of the world, some in the US, some in other parts of the world. And as they come off the production line, we have planes going out to get them. And once they get to the US, they get taken off planes, taken off their pallets, broken down into the individual tests, and then repackaged into the tests of 4. There are large distributor centers that are being used for the operation. There are huge numbers of people that are on hand to be able to do it as quickly as possible. And anyone who's got an address in the postal system is able to go online and order one of those tests. At this point, Omicron is our major concern. It has replaced the Delta virus. Only a few percent of the virus is circulating. Less than 2% are Delta. Everything else is Omicron at this point. We are continuing to track around the world the possible emergence of new variants. We of course hope that there won't be, but we prepare as if there will be. And we don't have any sense of a variant at this point that's particularly worrisome beyond Omicron, but it doesn't mean that new variants can't emerge. Omicron arose without too much warning. And so it's going to be important for us to keep collaborating around the world, sequencing viruses, watching for new patterns to emerge. But at this point, we don't see anything that's concerning, but we do presume that there's a chance that we'll have to deal with future variants, and we need to get ready for those. So you're right that other countries are ahead of us, a little bit ahead of us, and we've seen in, for example, South Africa and the United Kingdom that they are on the downhill side of the Omicron surge and are rapidly falling numbers of cases. We've begun to see in the United States, particularly in parts of the East Coast, the numbers beginning to move in the right direction in recent days, which is great news. Parts of the country, unfortunately, are still on the rise or haven't quite plateaued. So we still have a lot of challenge to get through before the Omicron surge subsides entirely. Going beyond the Omicron surge and its eventual resolution, we need to prepare for future surges. We don't know the timing. We've had a challenge in the last 2 summers in parts of the country, particularly, it was particularly challenging in parts of the South where weather's hot and people are moving indoors. So and then of course, we've had 2 very, very serious winter surges. So we'll need to always be preparing for that possibility. We have new tools coming online, though. We have a lot more testing coming online. We have more and more people being vaccinated. We have more therapies that are coming online. So I think even though we may have future variants to contend with, we will have better tools, and we're getting more and more vaccinated, and people have much more knowledge. We're sending out masks for 400 million masks this week for anyone who wants one. Those masks will be particularly important in future surges when the disease incidence is high, but even now, as disease incidence is high during this variant. So we just need to continue to be prepared, and we don't know exactly what the patterns will be for the rest of the year. We hope that post-Omicron that we will continue to have a kind of a much lower level of disease, but we'll be prepared if we need to ramp back up.